We've got our electrodes in place over the patient's hamstring and we're eliciting a muscle twitch. This would be again around the day 10 mark. What we basically want to do is increase the blood flow to the area and start to get the muscle firing following the injury. Again, we're looking at trying to minimise discomfort of the patient and minimise the risk of further injury. For our next progression, I'm going to ask the patient to do an isometric contraction of the hamstrings. We've got our electrodes in place and again we're superimposing the contraction elicited by the Chattanooga Wireless Pro into the patient's active contraction. I'm going to resist that contraction and I'm going to ask the patient to contract during the active phase of the treatment program and then relax during the relaxation phase into some more functional activity. Again, you've probably progressed through some isometric hamstring contractions and into a basic weighted curl. With a bridge, we find it's a bit more functional, and again, we get the patient working with the Compex or the Chattanooga Wireless Pro to superimpose that contraction through the active phase of the treatment cycle. A progression from this would obviously be into a single foot bridge. We'd incorporate this depending on the patient's response to treatment, how they're feeling symptom-wise, and obviously the stage of recovery that they are following the hamstring tear.